This medication is used on the skin to relieve itching and pain from certain skin conditions such as scrapes, minor burns, eczema, and insect bites. It also treats minor discomfort and itching caused by hemorrhoids and certain other problems of the genital/anal area, like anal fissures and itching around the vagina/rectum. Some forms of this medication are also used to decrease discomfort or pain during certain medical procedures/exams, such as sigmoidoscopy and cystoscopy. Lidocaine is a local anesthetic that works by causing temporary numbness/loss of feeling in the skin and mucous membranes. When using the WPR Plus kit, cream, or gel, it's important to follow the directions on the package carefully. If you have any questions, you can consult your pharmacist or doctor for guidance. Before applying the medication to the skin, make sure to clean and dry the affected area as directed. Apply a thin layer of the medication to the affected area of the skin, typically 2 to 3 times a day or as directed by your healthcare provider. If you are using the spray, shake the canister well before using it. Hold the canister 3 to 5 inches from the affected area and spray until wet. If the affected area is on the face, spray the medication onto your hand and apply it to the face. Avoid spraying near the eyes, nose, or mouth. If you are using the foam, shake the canister well before applying it. Spray the foam onto your hand and apply it to the affected area. It's important to not use the medication on large areas of the body. Cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor, as this may increase the risk of serious side effects. After using the medication, remember to wash your hands unless you are treating an area on the hands. Avoid getting the product in your eyes, nose, or ears, and if it does come into contact with these areas, rinse with clean water immediately. The dosage of this product is based on your medical condition and response to treatment. It's crucial not to use more of the product, use it more often, or continue using it for longer than directed. If there is an infection or sore in the area to be treated, consult your doctor before using this medication. If your condition does not improve or worsens, or if you suspect a serious medical problem, seek medical help right away. After applying WPR Plus kit, cream, or gel, you may experience temporary redness, stinging, or slight swelling at the application site. If these effects persist or worsen, it's important to inform your doctor immediately. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the risk of potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to seek medical help right away if you experience any very serious side effects, such as slow or shallow breathing, seizures, pale or bluish skin, unusual tiredness, shortness of breath, or a fast, slow, or irregular heartbeat. While a very serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including a new or worsening rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, it's advisable to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before using WPR Plus kit, cream, or gel, it's important to discuss any allergies you may have with your doctor or pharmacist. This product may contain inactive ingredients that could cause allergic reactions, so make sure to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have broken skin or an infection in the area where the medication will be used, heart disease, liver disease, or a certain blood disorder called methemoglobinemia. If you are going to have an MRI test, make sure to tell the testing personnel that you are using this product. Some brands of this medication may contain metals that can cause serious burns during an MRI and should not be used before imaging. Ask your doctor or pharmacist for specific questions about your particular brand. Before having surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's also important to note that children may be more sensitive to the side effects of this drug. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Finally, this medication passes into breast milk, but is unlikely to harm a nursing infant. However, it's always best to consult your doctor before breastfeeding. Remember, WPR Plus kit, cream and gel may interact with other medications, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure you are using WPR Plus kit, cream and gel safely and effectively. If someone inhales or swallows this medicine, it could be harmful. If someone has taken too much and is experiencing serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. Symptoms of an overdose may include drowsiness, irregular heartbeat, and seizures. Remember to keep this medication out of reach of children and pets. Always follow the dosage instructions provided by your doctor or pharmacist. If you have any concerns about the use of WPR Plus kit, cream, and gel, speak with your healthcare provider for personalized advice. Make sure to keep up with your regular medical appointments and any necessary lab tests. This will help ensure that you are using the WPR Plus kit, cream, and gel safely and effectively. If you are using the WPR Plus kit, cream, or gel on a regular schedule and happen to miss a dose, simply use it as soon as you remember. However, if it's close to the time of your next scheduled dose, it's best to just skip the missed one. It's important not to double the dose in an attempt to catch up. Stick to your regular dosing schedule for the best results. When using WPR Plus kit, cream, and gel, it's important to store them at room temperature and avoid freezing. Make sure to keep them out of reach of children and pets. Additionally, it's crucial to avoid storing the gel or foam near high heat or open flame, as well as not puncturing or burning the container due to pressure. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless specifically instructed. Instead, properly dispose of it when it's expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.